Hi, so we wanted to create a podcast with the theme of emotional wellbeing for our staff here at St Bart's Hospital. And we thought probably the best way to do that was to have a bit of a reflecting team made up of different professionals, where we're really just exploring the different themes of different issues that might be causing anxiety for staff at this time. My name's Vicky Kelly and I'm a consultant clinical psychologist here.
So I've got some colleagues at home who are self-isolating, and I was just wondering what might be helpful for them to think about whilst at home in order to help them whilst they're isolating.
While they're isolating, yeah. It's a really difficult time at the moment. Like you were saying earlier, we're in unprecedented times, and during a lockdown, we can't have access to a lot of the things that we would normally use for our well-being, like going out and seeing our friends and doing nice activities. So I think in terms of stuff for people who are self-isolating, one of the main things I think which is really important is thinking about routine and structure and trying to keep that in our days as much as possible. So trying to get up at the same time every day, trying to eat breakfast, lunch and evening meals at the same time each day, and trying to sort of have a kind of routine where there's bits of rest peppered with bits of activity of stuff that people can do at home, and sometimes it's helpful to actually plan this out. It sounds a bit cringeable, but actually sometimes it's really hard when you wake up in the morning to think, what am I going to do today, if they're self-isolating but they're quite well. So actually maybe making a bit of a plan, just using their phone or something the night before and thinking, I'm going to get up at this time, I'll have my breakfast at this time, I'm going to FaceTime my friend at this time, I'll have my lunch at this time. And also, I suppose another thing that might be helpful is using the opportunity, if they've got family at home, to really sort of spend that time with their family to strengthen family bonds. It might be making the most of that time where they wouldn't normally have that time with their family, and that can be quite helpful. And then really thinking about for people who might become overwhelmed with how they're feeling, if they're feeling very anxious, trying to encourage people to focus on what they can control rather than thinking about what they can't control. So we can't control our feelings. We can't, unfortunately, control this coronavirus and the impact it's going to have on us and the way we live our lives. But what we can control is our behaviour, and we can control, and by behaviour I mean doing things like keeping routine and structure and thinking about sort of activities that are going to improve our well-being, albeit within the confines of our home. Yeah.
So if somebody was feeling overwhelmed or they needed psychological support, how would that work? What would that entail?
If someone wanted to get that sort of psychological support if they were at home. Well, for staff, we've there's a whole heap of resources on the WeShare pages, which are sort of links and signposting to different areas. They could also, there's a blog that I've written in terms of managing anxiety that might be helpful for people to read, which is based on the work of Ross Harris. He's a psychologist who works in acceptance and commitment therapy, and actually I'd recommend a lot of his YouTube videos. Actually, he's got lots of YouTube videos on managing anxiety, and that's something that people can access very easily from their home as long as they have internet access. The difficulty that we've got at the moment is our normal systems of support. So I'd normally be saying, go see your GP. They can help arrange some support for you if you're really concerned. And we just don't have that sort of same availability at the moment. And a lot of people might not need that level of support. It might just be that they need some guided self-help to just help them think about how their anxiety is being maintained and what to do to help manage it.
And if somebody is at home, is there any way they can access the WeShare website from home?
Yeah, I tried this. You just have to log in. So you have to, so staff, as long as you're obviously a staff member of Bart's, you just have to log in with your username and your password, and then it lets you into WeShare from home.
I didn't know that. That's good to know.
I only discovered it recently. Very good.
And how do we find the blog you were talking about?
So if you go onto the WeShare pages, there's a whole section on well-being, and there's a list of sort of hyperlinks to different signposting of different helpful web pages. So then my blog is there, and also my colleague Francesca created a really nice poster as well, which is about managing anxiety in the coronavirus situation.
So I guess just from a medical perspective for the doctors, there's a couple of things that probably are creating a bit of anxiety. One is that all of our trainees are staying in the same posts as they were in when this crisis started.
Yeah.
So that will be certain trainees who were planning to go into research and they can't now go into research.
Yeah.
There's certain trainees who were planning to rotate around to different rotations, so they can't carry on doing that. Other trainees who are in research and have been called back now to do to out of research back into full-time clinical work. And then people who are at the end of their training who are kind of stuck a little bit because they're applying for jobs, but those jobs are not there anymore and they're just stuck in the same job. So I think that is creating a bit of anxiety for people, particularly people who are probably writing up their PhD. They have to stop, or how will this impact them over the next few years? So it's not just this few months that they're out. It's actually has a knock-on effect to everything else. So I think there is quite a bit of anxiety around that. But I think everyone's in it together, so there should be a way around that, and I'm sure there will be a way around that. But I think in the moment it is causing some concern.
Yes, absolutely. Because I suppose what you're describing are people who don't have kind of permanent contract jobs, like we're talking about. They're in a training post, and so then to have all of that. Suddenly have the pause button pressed on that must be really anxiety provoking, and especially the workload that you're describing there is immense anyway, all the kind of different work that they're having to do clinically and also kind of academically,
and then having to pick that up again later on is quite difficult. So I think that's one thing. The other thing I think we're all probably in this position a little bit is that the way we treat patients and the way we manage patients is going to be quite different, even if we don't go to intensive care, for example. We stay in our own specialties. The way we manage people will be different because of the effect of COVID-19 on the amount of resource that we have, the areas for clinical care. So, for example, the access to intensive care for some of our patients who will come in very high risk, people who have had arrests in the community or have had big heart attacks, who otherwise potentially could have gone to intensive care, but now obviously our decision making is going to be slightly different, and that is difficult for us because we're so used to managing people in one particular way, and suddenly now we can't do the ideal scenario. We can't go with our ideal and optimal medical management plan. We have to change that because of external pressures. And that's completely understandable, completely reasonable in this situation, but it is something that is a little bit difficult on a number of levels. So I think for us, we're trying to work, as I said, in a more collegiate way, in a more multidisciplinary way, where there are more than one or two people making those decisions. That's much more of a team decision where people are so, for example, we often have difficult decisions in the middle of the night where there is only one consultant, one registrar on covering. So decisions about whether we resuscitate a patient or not resuscitate a patient, when to stop resuscitation. Sometimes those plans are made not even in the hospital, sometimes they're made as the patient arrives in the ambulance. So what we have now is a shadow team who are on, so we can call them and say, look, this is difficult, this is a difficult decision that we have to make. What do you think? Do you agree with the decision? And so at least then you have a couple of people who are involved in that decision making and maybe an objective opinion from kind of outside that environment.
So it sounds like you have some experiences that you can draw on for times like this, but it doesn't take away from it being immensely
No, we've never been
decision.
in this position before.
Absolutely.
So it's just not what we are. What we're used to doing.
No, absolutely. And like you say, there's often you're having to make difficult decisions in normal running of things, but this is like nothing else. And the emotional burden on people is absolutely massive for that.
And I think it will obviously, I'm talking about in our the way we work at the moment in our specific subspecialty area, but actually, you know, as we know, we're all going to be redeployed, we're all going to be making decisions in an intensive care unit, which we're not used to making, and which are going to be difficult even for the people who are used to making those decisions. And those are difficult decisions to come if things go the way we think that they may go.
Absolutely.
So I think all of these things, as you said, are unprecedented.
Absolutely. And again, I think it just really emphasises the kind of importance of people accessing support for this, because people are going to be experiencing huge amounts of emotional burden from those decision-making processes that you're describing, and to be able to have a space with colleagues at some point after that experience to make sense of that and to acknowledge the enormity of what they've had to do, and that it's okay to feel how they might be feeling after that would be really important.
Things like team debriefs, we do that routinely anyway, but I think that kind of things are going to be much, much more important now, especially in the first few decisions that you make like that are going to be very difficult. Later on it will become a bit easier because we're getting more used to it, but I think the beginning, those things are going to come into be really, really important for us.
Absolutely. And can I ask, when you're having to do those difficult decisions in at other times, what support systems do you sort of draw on then to sort of help you through those difficult decisions? Because obviously you, like we're saying, this is unprecedented, but you are having to make difficult decisions in other contexts. What sort of helps, or what are the key things to think about to help support that process normally?
I think normally there is always a team there.
Yeah.
It's a small team, obviously. We don't have a backup team to go and speak to, but we're used to making those type of decisions. Yeah. So within our team that's looking after that patient at the time, we make a decision. Yeah. We have intensive care that helps us to make that decision sometimes. Yeah. Obviously now we're going to be less able to call on them to make those type of decisions, but they should, I think they will still be involved. Yeah. But I think it's just what we're used to doing. Yes. We're used to making those decisions. Yes. We do have colleagues, and there is always a multidisciplinary element to it. Yeah. But I think these are going to be decisions that nobody's used to making, and we'll have to make those in a bigger team.
I think from our team, one of the things that, well, it's not the really urgent decisions like you guys are making, but there are decisions to make that really do need to be made as a team. For us, we tend to base most of our decision making. It's very scientific. What does the evidence base say? That's what we do.
Don't have that.
And we don't have the evidence base for a lot of these decisions. We might have a patient, for example, which is going to be the lower risk for them, to bring them in and have a procedure early and then get them home, or to try and postpone their procedure until after this, and weighing that up when you don't really have any evidence of which is going to be the best for them is really difficult, and no one person can make that decision by themselves without the scientific backup. So it has to be, like say, a real collegiate effort to go weigh up the pros and cons, all the different ideas. What do we think is the best, and using a judgment and having that,
and be open with that with the patient.
Yes,
to say, look, we're in this position, we don't know what the right answer is, this is what we think is going on, what do you think, and have that discussion. Obviously that may be difficult with coronavirus and patients who are intubated and all those things, and without any family around either, because that might be the case that we'll have to be making these decisions without family input. But it's but I think having those people to say, look, there's this many people have all thought of the same thing, come to the same conclusion.
Absolutely.
But I also think that we need to remember that we are able to do this.
Yes,
this is not a good point. This is not out of our ability or capability to be able to do this. Yes. And we have all the skills with us to be able to push us into this position and make these decisions, because that's all I have to say.
I agree. I mean, that was reminding me actually back to our initial discussion about redeployment, because I think it's very normal before any big change for there to be huge amounts of anticipatory anxiety, and then what we normally find is once people get settled into a routine, even if that is so far away from business as normal, if it is some kind of routine and people become more familiar with tasks, then we do adjust. And we do start to feel slightly less anxious as it feels slightly, you know, like the new normal, as hard as that might be for a lot of people. So I agree with you. I think it's remembering that people do have these skills and that we can do it, and it's okay to feel anxious about that, but to remember that actually as we start to establish into these new roles and into these new scenarios, they will start to feel more less anxiety provoking.
Yeah, I think exactly as you said, we do need to remember that, okay, we may not have a big body of evidence behind this, but we have people with the skills and the experience and the scientific knowledge and background to be able to, you know, make reasonably well
judged decisions. Exactly.
And you can never be 100% sure that's going to be the right decision, but if you've got a group of you as professionals with the skills and experience behind you to make those decisions, then you know, we can be as confident as we ever can be that we're doing the best for our patients as much as we can, and the best for our colleagues as well. And even if we perhaps find it a little bit difficult to kind of go, right, well, I've got this, and we've got this, if we can try and approach it, as like you say, really focus on the team aspect of it, then hopefully we can use that as a comfort for that.
Yes, absolutely.